WRMC Medical Complex in Newport, and we're going to introduce to you today Will Moore. Good to see you, my friend.
It's nice to see you too.
A Batesville, Arkansas guy, a Batesville
That's
pioneer.
correct. That's right.
And came back home. But let's talk a little bit about you, APRN, Batesville Cardiology at WRMC up there, but comes to Newport at the WRMC Medical Complex the last Tuesday in every month. But I want to find out a little bit about you. Tell us about Will Moore.
Well, I was born and raised in Batesville, Arkansas, and graduated there in 1996. Played a little basketball against the Greyhounds over here in
Yes, sir.
7th and 8th grade. I can't remember who won or lost those games. We were just talking about that. We had a good time, real competitive. And went to the University of Arkansas for several years and got some undergraduate studies. Found myself back in Batesville going to nursing school and did that and then went on to get my master's degree in Tennessee.
Well, you talk about, we're going to talk a lot of things about cardiology, and February being, we're talking about heart health and the things that it takes to make us healthy. That's what we're going to be talking about today. And Will, some of the things that are so important, everybody's concerned about their heart. And heart health has changed over the years. Talk a little bit about some of those changes, and then we'll get into talking about the apps and the wearables. But talk a little bit about the change in itself.
You know, that makes a good point. We've seen kind of a transition over time to where you know, we're really focused in on our cholesterol and our blood pressure and our activity levels. And you know, over time, it's just really honed in on meeting those goals, meeting those cholesterol goals, meeting our activity goals, meeting those weight goals and parameters. And those things may be a little bit on one side or the other, but we have these kind of standards that we meet when it comes to, you know, tobacco and modifiable risk factors when it comes to heart disease. So many of the things that we can change on our own, and you know, they calculate to a cardiac risk.
Sure.
And so you know, we've kind of really honed in on focusing in on 4 or 5 things that put us at risk that we can change. And you know, it kind of falls under the category of, you know, my role or your primary doctor's role or your cardiologist's role to really work with these risk factors and make some moves to reduce your risk for having an event, heart attack, stroke, or other problems like heart failure. Well,
and you talk about those risks, and what we try to do is we're trying to prevent heart disease with those risks, knowing what those risks are.
Absolutely.
Once you identify the risk, then you've got a plan.
Absolutely.
And we have a plan that's a little bit different today when you start talking about these apps and these wearables. And let's get into that and talk about some of the things, information that we have that's at our fingertips.
Yes, yes. So we've got a lot of technology today. You know, as things have really boomed with the apps. You know, we say there's an app for that.
Right. Absolutely.
Now, so we've got some apps and some wearables that'll help us keep track of things, help keep us motivated, and to meet our goals when it comes to nutrition and exercise. So you know what? A couple examples. I'm not endorsing any specific product, but you know, we've got a couple of good examples of MyFitnessPal. This is something that we can download, you know, on our smartphones, and you know, too may go in with our wearables. You know, where it may be a Fitbit or an Apple Watch or another piece of technology. But these will help calculate, you know, your caloric needs, whether it's your protein, salt, sugars, fats, and really you can even scan some of these things in by using your phone and just capturing that barcode, and it populates what's exactly in that food.
Sure.
Two, you know, it helps us keep up with our exercise. You know, that caloric, you know, intake versus output. You know, how much are we burning? You know, how much are we putting in? You know, what's our weight loss goals? So, you know, that's one way to do it.
Well, you talk about their Apple Watches, Fitbits, and things, and kind of explain what those devices are, how they work. Somebody my age might go, I'm not really sure what that does and how that calculates, but to the younger generation, everybody knows, but those of us who are in the, anybody could be in the heart age as such, but kind of explain what all that stuff is.
So, you know, there's nothing that, you know, as far as what's going to be beneficial to us than something like a pen and paper and recording this information, and then to having it where we can visualize it. If we don't really record it, we don't know what's happening.
Sure.
So, you know, if we can demonstrate that in, you know, a way that's obtainable and that we can interpret, then we can see results over time or track some of the things that we may can improve on. So, you know, if we just had a pen and paper out, you know, this is the same as what we're going to collect on this data on the watch, except it's like having a secretary already built in
Right.
you know, for us on this app potentially, and it makes things a little bit simpler. So, you know, with that, we can use this technology and, you know, maybe make some real progress for ourselves.
When we talk about, you know, heart and cardiology, and the one thing that I think of all the time is that, you know, you talk to the cardiologist and say, well, you need to exercise more. And of course, that's part of it. I mean, if you exercise more, you're supposed to be healthier. But and these devices can record the steps that you take and how much exercise you're getting. And when the cardiologist asks, how much exercise have you been getting? And you go, well, I walked up and down the stairs twice and around the house, but you can actually record that information and have it handy.
Exactly. You know, so a lot of the wearables and even the apps on your phone and the smartphones will record your steps, and 10,000 steps a day is kind of a goal for healthy living and healthy heart health.
Yeah.
So, you know, being able to track that with a wearable or the app on your phone is extremely beneficial.
Well, there's no doubt that the technology has changed, and we talked about it here today. And I got to ask you this before we get off here, and I always ask when I visit with people in the medical profession, in the health field, why did you choose cardiology? Why did you choose medicine, number one, and then cardiology more specifically, number two?
So, you know, just as far as my strengths and just being raised here in the South and in a rural area, I grew up, you know, hunting and fishing. And, you know, you kind of learn about biology and the environment. You know, and I think it's made my math and sciences a lot easier.
Right.
And so, you know, just looking at the anatomy of an animal just translate into our own anatomy.
Sure.
And so I've always just been really active too. I love sports. I love just any outdoor activity. So just being, you know, kind of an athlete, I would say I like to put myself in that category, but I'm not as competitive as I was when I was younger. But just trying to stay active and being heart healthy has found myself in cardiology.
Who do you work with in Batesville?
I work with a very seasoned cardiologist, 30 plus years in the business, Dr. Rick Van Grau, and I consider myself an extension of him when I'm here. And so if you're needing any help, you know, we're here for that on last Tuesday of the month.
Last Tuesday of the month, and that's the day we record because we caught him here at WRMC Medical Complex in Newport. But we welcome you to Newport, Arkansas, and I know that you're doing a fantastic job. Annie has said it's just you're marvelous, and I know the folks in Batesville are glad to have you home, and we welcome you to your one day a month.
We work with a good team, so thank you.
No doubt about it.
We're here today.
WRMC Medical Complex in Newport. Call us when you need us.